titled Soul Sisters, Discourse on the Woman on Smooth 98.1.
Okay, coming in. Emmy Melly with our unofficial official soundtrack for Soul Sisters every Wednesday from 11 till 11:50, right here on the station that loves music and loves life. You are welcome to the show that puts the woman right at the forefront, and we discuss every and anything that concerns the woman, from our financial health to her physical health, to her emotional health, her mental health, and everything: personal development, leadership skills, empowerment, and even the woman integrating into the tech world and leading at that, from AI to technology and other things. We'll discuss everything and anything that we can every Wednesday from 11 till 11:50. My name is Oluwaseun Olusegun, and again, you're welcome. Today, if you have been a part of our WhatsApp family, you would have seen the flyer telling you what to expect and look forward to as a main discussion of the show. We are talking about something that has been talked about for a long time, but now we want to shed light on it and give the facts, as well as clear some misconceptions, some stereotypes, and also help you to make peace with some things that are inevitable. We're talking about beauty and aging, not in isolation, but then in the context of cosmetic enhancement. And so today, get ready to have your mind broadened, especially whatever it is that you have had or the knowledge you have had about cosmetic enhancement in the time past. We're going to redefine it. And you know, I am not an expert. I didn't go to school to study any form of cosmetic enhancement. I do have my guest who's joining me, not just via Zoom, but I think it is the dead of the night where she is right now. And it is so beautiful, so humbling. And I'm so grateful for her presence, joining me all the way from the United States of America. She's Harvard educated, California trained. She's a highly sought after physician. She specializes in cosmetic and reconstructive surgery of the face, breast, trunk, and extremities. And she's deeply committed to helping people to reveal their inner beauty through physical transformation. So please welcome with me American board certified craniofacial plastic and reconstructive surgeon. That is Dr. Chinwe Kpaduwa. Good morning.
Good morning. Thank you for having me. Excuse me, my voice is just waking up too.
I mean, thank you for waking up early. It's 2 a.m. over there to just be a part of this. I appreciate it so much.
No,
Thank you.
always, always. I'm always loving this experience that I have with you, so I had to come back.
Okay, so let's get to the basics of beauty. This is a conversation that I think way before many of our grandmothers and ancestors were born, what beauty is has been talked about. So I want to go back to the evolution of beauty, maybe as you see, based on what has been studied and in your field of practice as a plastic surgeon. How would you define beauty?
Well, the old saying holds true that beauty is ultimately in the eye of the beholder. I think that we have tried as plastic surgeons and even dermatologists and other physicians who are concerned with beauty to kind of define what that means more objectively. So I think some of the standards hold true. Symmetry is always considered beautiful, facial symmetry, body symmetry. And ultimately, proximity to youth has been increasingly associated with beauty. So people who look younger, um, less wrinkles, better skin, more plump features, that has increasingly become appreciated as beautiful.
Hmm. And if you look at the people of color, I think there was a time I came across somebody's picture a white person, and she was nowhere near fat, and she was called as or described as fat. Meanwhile, over here, that same person would be regarded as skinny. So I'm looking at the contrast, or is there a global ideal of beauty, or it varies based on the continent, the race, your location?
So I think, before we had internet, before we had social media, before we had television and movies, there were very stark contrasts between the white world, the Western world, and Africa, and even Asia. I think, though, as we increasingly become a global community, our definitions are melding. So, in Nigeria specifically, a person with a big bum has always been in fashion. Um, and that's now becoming more of a global phenomenon, whereas before everyone wanted to be really, really skinny and have more breast than bum.
Mm,
So I think we are merging in terms of what our definitions of beauty is. And I think that as we merge, we're also seeing the Western world kind of move towards, what used to just be an African or an ideal for people of color. Um, it's now becoming the way of the world that everyone wants a BBL or Brazilian butt lift. And that didn't used to be the case, a decade ago even. So we're definitely seeing things come together, definitions kind of mixing. Um, so that is true. There's less of a difference now between us and the Western world.
like you said, that was not the case many years ago. So, aside the obvious being social media, do you think there are some other factors contributing to this beauty ideals and standards these days?
There are some, but I mean, I think social media is the prevailing one. We have always been people who travel, meaning Africans. We've always been people who travel, and so we've always been able to have access to the U.S. and other countries like the UK, where the prevailing sentiments were around beauty, were around, white women's beauty. Um, so that's been true for several decades now, but I think social media has really, really changed the game in terms of what we're seeing out there, what we're seeing people ask for, what we're seeing people appreciate more. So I think social media is the biggest one that we can turn to.
Hmm. I remember a video, although I didn't get the full details in that video of yours, but there was one that you talked about children or younger ones being, do I say, pressured by the beauty ideals these days. I mean, can you re-echo your thought on that?
Yes, I think so. It's not about one person's insecurities about themselves, right? It's really about the culture that we create that says this is what is beautiful and this is what is not. And there used to be a time when children weren't necessarily exposed to that so so integrally. It wasn't something that children were bombarded with all the time. I remember growing up, yes, I saw that white girls got dates. I saw that white girls were told they were pretty. And that didn't help me in terms of my own self-esteem. And I saw TVs and movies that showed women like Julia Roberts and, again, reemphasizing that white women were the standard. But that was something that I could turn off, right? If I weren't at school, if I was with my family, I got a different view. It wasn't something that I had 24/7 bombarding me. And now we have social media in the hands of young people. Young people are on Instagram, they're on TikTok. They're on it more than their adult parents are. And they now have school, television, movies, social media that they're attached to at the hip, telling them this is one way that beauty is defined. And so if you are constantly surrounded by that, there is a culture that you instinctively know exists. And the question is, are you part of that culture or are you different? And most of us are different. We're not part of the culture that we see on Instagram. We may even create our own culture on Instagram that we aren't a part of. What I mean by that is if you go to the For You page or you go to, I don't know what Instagram calls it, but the Explore page, basically, you're seeing things that are similar to what you've liked in the past,
Mm-hmm.
right? Things that are similar to what you viewed in the past. And so that is a culture that you created, but you actually may not be at the center of that, which is interesting, right?
Mm.
Right now, my Explore page is full of babies, workouts, and vacations. Right? Some of those things apply to me, but a lot of those things don't apply to me. And so I'm constantly surrounded by that. And you can imagine what teenagers are looking at as well. So the idea is that even though you're creating this culture for yourself, you don't necessarily identify with a lot of what it is. And so you're constantly seeing messages reinforced of this is what is beautiful. And you're constantly asking yourself, am I this person? And if the answer is no, or am I not, do I see myself in this person? If the answer is no, that's a very, very terrifying message, I imagine, for someone who's growing up and learning what it means to be themselves in this world.
Thank you. We'll take a breather now, and when we come back, we'll start with the talk about how the plastic surgery sector or the beauty industry is exploiting the inadequate self-esteem or the negative self-esteem or the low self-esteem of individuals. So I wouldn't say what do you have to say in defense, but what would you educate people on when to think about plastic surgery and the likes? That's what we'll come back to right after this. You're listening to Soul Sisters on Smooth 98.1.
And you're tuned to Smooth 98.1.
So we just have less than a minute break and we'll come back.
Okay.
Minus 30 seconds for a secure future. Begin final checks. Access pensions passengers. Check. ARN pensions passengers. Check. Access ARN pensions. Go. Introducing Access ARN Pensions. Bespoke retirement solutions to suit your needs. Access ARN Pensions. It's your time.
What's up, Nigeria? It's your girl, Iyabo Vibes, and you're listening to the smoothest dial on Lagos Radio, Smooth 98.1.
Yes.
Touch that dial.
You shouldn't at all touch that dial, especially if you're interested in adding to your knowledge about any form of cosmetic enhancement, body enhancement, or plastic surgery, or even clearing whatever information you have had stored over the years. Take it as maybe learning, unlearning, and relearning. And today on the show, we do have board certified craniofacial, plastic, and reconstructive surgeon, Dr. Chinwe Kpaduwa. You can join us on YouTube, by the way. So you see my face and her gorgeous face and skin. That is at Smooth 981 FM Lagos, at Smooth 981 FM Lagos. Permit the little distraction and the digression. How many times have you had people asking you drop your skincare routine? Because I think you have what you call glass skin. And how did you achieve that?
I get that a lot. So I always say that people either are born with good skin or they work hard for good skin. I think I worked hard for good skin because growing up I did not have good skin.
Oh.
But yes, I get it a lot. It actually is on my YouTube. So if people want to know my routine, then they can go there. But basically, I use South Korean products. I love South Korean products. They're great, and if you layer them, they work beautifully. So definitely check out my YouTube for that.
Okay, we'll circle back later on to something about
Okay.
skin, but for now, let's try to understand better plastic surgery and what should come to a person's mind. But I want us to start from what do you think when people say that the beauty sector, plastic surgeons and co are exploiting or preying on the self-esteem issues of people, both male and female?
I think it's fair, right? My job
What?
wouldn't exist. I think it's fair. I think my job wouldn't exist
That's what
if
I was expecting. That was too truthful.
My job wouldn't exist. I mean, yes, I do reconstruction and so that that plays into it. But on the cosmetic side, my job definitely wouldn't exist if it weren't for people having insecurities that we allow them to have and, allow them to address. Um, is it so predatory for most plastic surgeons? No, I think we, as people, that we enter into this field honestly wanting to help people, right? And so it's not that we are predators, like, monsters or anything like that. But I do think that the field as a whole thrives when people are want to change something about themselves. And so I think it's there.
Okay, so let's understand some things to note about plastic surgery. For instance, is it the fix to everything physical and maybe mental? I mean, when you look a certain way, is it possible for you to totally alter it? Before I even go on, I was very shocked the day I came across the height adding surgery, where you can add about 3 to 6 inches to your height.
Yeah,
And
yeah.
so, is there any limits to what a person can do in terms of how they look and changing that?
Obviously, yes. We're not magicians. There, what I say is, especially when you leave my operating room, right? You will look like the better version of you, but it will still be you. Um, there are some plastic surgeons who are doing complete alterations to the point where the original person is unrecognizable. But I would say that for the most of us, there are limits to what we can do because we're not violating kind of basic tenets and principles of plastic surgery. So is it the fix for everything? No, no. Especially not the mental piece. And what I emphasize is that if you can name 5 things right now that you would change about yourself physically, that to the point where you would actually get surgery, then the problem is not your physical self. And there's something deeper that needs to be addressed before you seek anything from a plastic surgeon.
Okay, let me backtrack on that. If a person wants to get surgery done and they feel I want to change these things about myself, that should not be the first port of call. You need to first fix whatever is making you want to change that.
So if I went in for a nose job tomorrow, would I need to go to a mental health physician beforehand? No, I'm not saying that. I think that there are legitimate things that people, usually there's 1 or 2 things that people just don't like, right? I don't like my booty. It's always been small. And if someone said to me there were a magical fix where I didn't have to go under surgery, I would get it done. Maybe, actually, I don't know, maybe. So I don't think it's every time that someone wants to get a plastic surgical operation that they have to think about going to a mental health physician or psychiatrist first. No. But I do think it's important to always be examining why you want to change it, right? And so when I come back to my booty example, it's that I'm from Nigeria and I'm from a Nigerian family, and everyone in my family has ikebe but me.
Did you just say?
So that's the root of my own insecurity, right? So I think, yeah, I think it's good to, and that's why I talk a lot about kind of what is bad about plastic surgery, because it's important to examine why we do the things that we do before we do them.
Thank you. That's explanatory. Now let me go to the aspect of you wanting to help people bring out their inner beauty. What does that mean?
So I think that everyone is beautiful. Everyone has inherent beauty within them. And for some people, the external beauty is very apparent, and for others, it is not so apparent. And it's not even about how other people view them, it's how they view themselves, right? And so if we're coming back to a person getting a nose job again, for all their life, they've had a very classical African nose, let's say, and they want to look a little bit more European in terms of their nose. If that to them is what hinders them from feeling like they are beautiful, if that to them is what says to them, I am not looking good enough, then one change to make them less classically African in the nose can can really be powerful for them. And not just be a physical transformation, but also be a mental transformation as well, where you now say, okay, that knows that I used to hate so much, I now love. And so now I love everything about myself. People present to the world differently when they feel confident in everything that they have. So it is a very, very kind of powerful transformation that we're able to make with just one simple change.
Hmm. I've always wondered, I mean, a long time ago, I used to wonder why would people want to alter their nose? Because I grew up thinking those who have pointed nose don't have the space to breathe in enough air. So why would I want to constrict? That was a crazy thought I had. Now, why would I want to constrict my nostrils? Why do I want something more pointed when I could
Right.
breathe enough air for two? But I guess it goes back to the beauty ideals and internet and the white idea of beauty.
Yeah, yeah, for sure.
Okay. Now, moving on, let's talk about this, the final one. Say you have the ears of the whole world, and there's something you need to help people clear about their misconceptions about plastic surgery. If there's one thing or two things you'd like to say about plastic surgery, that this is not how you have viewed it, what would those things be?
So I think that people think that cosmetic surgery is the only thing that plastic surgery is, and I love being a reconstructive surgeon. I also love cosmetics, but I love being a reconstructive surgeon, and that is to say that people who have been afflicted with trauma, burns, even people who are born looking differently, have major physical transformations, restoring them to kind of their former selves. People with breast cancer, things like that. So that I think is actually the larger part of plastic surgery that I don't think gets emphasized enough.
Mm,
I think the other misconception is that anyone can be a plastic surgeon because there are a lot of people out there who are billing themselves as gurus in a field that they actually haven't trained adequately in. People are taking weekend courses. People are not taking any, they're looking at YouTube and this is how they're learning how to do certain procedures. So and people are dying in Nigeria because of it. People have died because of BBLs that went wrong. So I want people to really, really understand that it is imperative to verify that someone actually has the credentials that they say they have before you trust them with your body.
mm.
And that going the cheaper route may sound like a good idea right now, but it you get what you pay for, and it may cost you more than a couple thousand naira or dollars. So it's very, very important as you're entrusting your body to someone else that you verify who they are, that they actually can do what they say they can do.
Thank you. I think I remember us talking a little bit about that the last time you were on the show, about the
Yeah,
things to be on the lookout for before you decide to get that cosmetic enhancement or the Brazilian butt lift.
yeah,
And speaking of Brazilian butt lift, maybe it's just me, but it looks like ladies these days are tending to look the same. Everybody's having the same shape from
yeah,
the back.
yeah.
Why? You go to events and everybody's just tucked in. They can hardly breathe. They can't even eat more than one plate of jollof rice or half a plate of jollof rice. And everybody's looking the same.
Everyone
Why?
is looking the same. I know. I'm hoping that 2025 brings an end to that and we see more diversity in terms of shape. Well, I mean, even think about your favorite Wizkid song or Davido song. They talk about mommy wata fine. So, everyone for my aunties again always had that hourglass shape. And so we're just taking that to the nth degree. And people who wouldn't have had it, or who weren't born with it now can get it with the
Mm,
plastic surgeon. So that's why everyone looks the same. It's always been ideal, especially in Nigeria, to have a really, really nice shape, small waist, big boom boom, right? And so now, now if you weren't born with it, you can definitely get it. But I hope that we are moving away from that, and that people are just trying to be healthier looking Um, I think that's definitely coming in the next few years where people are not getting BBLs so much.
I hope so. I really do.
Yeah.
With the increase of the corsets, dresses, and all those things, it looks like we are still stuck there. But I really hope so that people will gradually move away from that. I wonder what the next decade will bring, the shape that we're going to have soon. Maybe it's, I don't know, I can't imagine what we're going to have soon.
I think it's always going to be the same. I think a small waist and big bum bum will always be the same, but the question is the degree to which the bum bum is so big and the waist is so small. And I think we're slowly moving away from this such exaggerated figure. Um, so it's gonna happen. I see it happening, but it's gonna be very slow, especially in Nigeria, especially in Africa. We're holding on to our old our old ideals. So, it's gonna be a slow evolution, but it's coming.
Hmm. Okay. We'll take a breather, another one, and when we come back, we'll be talking about beauty and aging, what you cannot do. I mean, the inevitable, something that you almost cannot stop, but looks like people are stopping it these days, and faces are freezing, foreheads are not moving, and smiles have become plastic.
Yeah.
I saw one person one day, a documentary, and I felt so bad. It felt like her face was a mold. And I'm thinking, how many fillers do you have in there? We'll talk about beauty and aging right after this. In case you're joining us for the first time, we are talking about cosmetic enhancement, understanding more about plastic surgery. And one of the key things you should be taking out of this is that there is more to plastic surgery than just the beauty, the cosmetic enhancement. We have reconstruction and more. And my guest is a board certified reconstructive surgeon as well as cranial, facial, and plastic surgeon. Do stay with us on Soul Sisters.
98.1. Love music, love life.
Hey, hey, mama. Okay, just some seconds as well, and we move back.
Okay.
It is cornflakes. 100% cornflakes. See, I mean, nutrition.
Okay, we're back. Love music, love life, love the sisters, love the brothers, love everyone who's interested in good information. And you're welcome to Soul Sisters. It's now 28 minutes past 11 o'clock, and every Wednesday from 11 till 11:50, what we do here is discuss every and any issue about women, educating them, and ultimately pushing them to be better versions and more confident versions of themselves. And at the end of it all, more money in your pockets, more and better self-esteem. Today, we're talking about beauty and aging, the cosmetic do's and don'ts. But before then, we have built up to this point, meaning we've discussed what plastic surgery is and what it is not, and some other things about beauty ideals as well as the evolution of beauty over the years. I have on WhatsApp a message from Chimezi, and before I take that message, if you want to contribute to the show or you have a question to ask, the WhatsApp line is 0809 444 0981. Again, the WhatsApp line is 0809 444 0981, while the call line is 0201 448 9981. If you're sending a message for the first time, please include your name and location. And if you'll be dialing that number to speak to us, you should please turn down the volume of your radio sets. Okay, let me take this message from Chimezie, who says, Good morning, Sheon, and the guest from across the sea. Since this is Soul Sisters, I want to make a comment on this topic. I listened to Miss Galaxy say that only about 4% of women in the world see themselves as beautiful and are confident. For me, this is worrying. The increase is alarming, no thanks to the media and the stereotype around beauty and what it is and should be. I see videos here and there about people who went under the knife, not just for cosmetic surgery, but to totally transform their personality, like a man who was transformed into a dog and one that transformed into a Dracula. Is this also part of what the cosmetic profession approve of, Dr. Chinwe?
No, no, no. So I haven't seen the dog one or the Dracula one. I do know that people sometimes get their teeth, filed down so they can look more like fangs and things like that. But no, again, credited plastic surgeons and people who are in the beauty industry are responsible adults for the most part. And so when you see the extremes, you know that's someone who didn't go to a person who has, in my opinion, ethics and morals and standards. So no, those are very extremes, and I would say that they belong to providers who do extreme things just because they can. But that is by and large not the majority of us. I do agree that 4% feeling like they're beautiful is an alarming number. I didn't know that it was so low, but I also am not that surprised, I guess, because a lot of us find faults with ourselves, um, and we're a lot harder on ourselves than others are. So it is sad, but I hope that the number who would actually get plastic surgery to address those things that they don't like, I hope that number is even smaller.
Mm. I was going to ask the obvious about the gender that feels less confident and why is there such a burden? Should I even call it a burden? Because at the end of the day, I guess people have the power of choice, but why it is applicable more to the female gender compared to the male gender in terms of feeling so low about their beauty?
Because men have always been graded on how functionally useful they were to society, right? It was their job to kill the cow and bring it home for eating. And so when that is your job, when that is how you're judged, there isn't a lot of room for how do I look as I'm killing the cow. Women's job was a little bit different. We have classically been caretakers of the home and the children. And even how a mate found us is even now, right? How well can you cook? That is one question that a woman can be asked on a date, and it's not surprising. Whereas I don't know that there are many women asking men, how well can you cook, right? But they may ask, how much do you make? How, are you bringing home enough to take care of me and our future children? So again, it's how we've always been judged differently. Women have been judged more about how they contribute to a home and by and large, how much they can produce in terms of children. And that has a lot to do with looks, right? Because if someone is looking for you to be a mate and looking for you to bear children, they want to know that their children will be beautiful. They will be smart and, they will have nice features. So women have classically been judged on how we appear in the world because that's how you tell how good of a mate we can be. Whereas men have been judged by how well they produce, how functional they are, how useful they are, how much do they bring to the physical table. So that's why.
That's just that. It's like the pressure is distributed in one way or
Yeah,
the other. Different people have what's expected of them.
right.
But just to circle back to the question that Chimezie asked and the explanation that she gave, are there regulations or the extent boundaries for what can be done and not allowed as touching any form of plastic surgery? Are there laws or regulations that says you cannot do this as a plastic surgeon?
I don't know that there are laws per se, but we have codes of conduct, we have ethics. So, for every step that you pass, there is a code that state lives by. So for instance, to become a medical student, to even begin to think about being a doctor one day, there's a standard, there is a code of ethics. To become a doctor, same is true. To become a surgeon, that is true. To become a plastic surgeon, that is true. So, that thread exists throughout our training, throughout our lives. And, the reason why I say that I'm board certified, the reason why I can say that is because I have been rigorously tested to make sure that my ethics, my values, my morals are sound, in addition to my ability to be safe and take care of patients safely. Right. And so when people are able to say that they are board certified or that they have been regulated by whatever, state, LGA country, they inherently are saying, I'm able to be this way because I have shown and demonstrated that I have boundaries. I I don't just do anything and everything to anyone. I have boundaries. So while there are no laws, there's a code of ethics and morals that we live by, that we practice by. And so it's when you see people going to, if a person would lie to you about being a doctor and be trained about being a trained physician, they are capable of anything, in my opinion. In my opinion. So that's where we're seeing all these extremes.
Okay. Now let's delve into beauty and aging. As a woman grows older, what are the normal changes that would happen from the face to the body? So we need to start with the normal before we go to what can be done if at all she wants something done about it.
So I would say, Black women don't age like white women do. And so what I will describe to you will take a lot longer in a Black woman than a white woman will. So the normal things that we see in aging, we lose volume, right? We lose fat, especially in places like our face. And so in addition to that, we have wrinkling that happens, we have sagging of the skin, we have jowls that form along the jawline. We again have the small lines around the mouth, around the eyes, and the forehead. So these are the things that we're seeing with aging. In terms of body, it depends on kind of a lot of factors. How well the person has maintained their body over the years. That's true of the face too, and then obviously if they've had children or not, things like that. So things that we see in body, sagging of the breasts, kind of more loosening of the skin as well, sagging of the skin. So, there are a lot of changes that we can see in the body as well that are associated with aging.
Okay. I know that many people have that issue with wrinkling, especially again in the age of social media where it's such a pride to be 60 and look 30. So if people have a problem with wrinkles forming on different parts of their face or their neck, is there something that can be done about it? Or can you slow down the progression? If yes, what should you do to help you slow down the progression?
Yes. So there's Botox. Botox is just the manufacturer, but the idea is that you're using botulinum toxin, and that classically it basically freezes the nerve that activates whatever. So in the case of wrinkling, it freezes the nerve that activates the muscle. So you can do that, and if you do it, so I advocate for doing it in lower doses so that you can still get movement, but that the movement doesn't cause such intense wrinkling of your face or anything like that. There are a lot of people with frozen foreheads, and the reason is because they use a lot of Botox. so, but then they don't have wrinkles. So so it's a balance though, right? But yeah, you can definitely, so in younger people who are 20s, 30s, even 40s, if you start low and slow with Botox, you can actually prevent a lot of bad wrinkling later on, as long as you continue to use it. And the key is that Botox doesn't last forever. You have to inject probably once every 3 months to maintain the look.
Really?
Mm-hmm.
I mean, aside the face freezing, depending on the amount of it that you take, what are the side
Mm-hmm.
effects? Because I assume there is always side effect for everything.
There are side effects, but they're minimal. So mostly people may complain of pain where the injection happens. They may complain of some redness or irritation where the injection happens. There are times that we see very rare side effects, like inability to open the eyes properly because the person who injected the Botox may have gone too low or gone too close to the eye. Some people, if the Botox migrates down, can have problems with speaking and sometimes even with breathing. So those are very, very rare. But again, as long as you go to a person who is trained in giving Botox, then those things should not happen. And what you may see is just very little irritation, if any of that.
Is there an alternative to Botox in helping to clear out the creases and the wrinkles on the face?
Yes, good skincare. So it's not an alternative. I think it can be used to help, but Botox I think is going to be the number one if people really, really are focused on wrinkling. But good skincare, keeping the skin well moisturized, keeping it well hydrated, um, using things like retinol-based creams that help with rejuvenation of the skin surface, and then sunscreen. Sun damage is the number one reason why people age, and so if you can decrease the amount of sun damage, you can increase the longevity of the face for sure.
Then in that case, it's not gender specific. People need
No,
to. Good.
yeah.
Okay. We'll take our final breather, and when we come back, we'll go back to understanding beauty, aging, as well as some of the things that you can do to prevent or slow it down. At least now we know something about wrinkling and what you can do. You're listening to Soul Sisters on Smooth 98.1.
Hello, everyone. This is Ruby Gang, and you are listening to Smooth.
A minute plus.
Love you.
Okay.
So that means when you start to take the Botox, you have to keep taking it until you're tired.
So not necessarily, right? You can not do it as frequently, and the more you use Botox, actually, the less frequent you have to do it because there aren't as many wrinkles there to prevent or to remove. So I still do. Once a year, I get Botox I have one little wrinkle here that I try to keep away. So that's once a year. Does that mean that, for 9 months out of the year, I have a little bit of a wrinkle? I do, but it's a little bit less of a wrinkle than it would be, So it just depends on the person and how kind of invested they are in getting things frequently done.
Okay.
Mm-hmm.
Interesting. For someone who dreads needles, Botox are definitely a no-no.
Say it again.
I said for someone who dreads needles, Botox are definitely no-no.
They can be. They're very, very tiny. So usually you don't even, and the way that we do it, we can distract you so you don't feel it. But yeah, if you're definitely afraid of needles, yeah, maybe not. Maybe not.
Okay. The final stretch of the show, 43 minutes past 11 o'clock, almost 44 minutes past 11 o'clock. On this 11th of December, 2024, it's Soul Sisters, and we're having the conversation about cosmetic enhancement, beauty and aging. And my guest is Dr. Chinwe Kpaduwa, who is a board-certified plastic surgeon. So now that we have identified what can be done about wrinkling that comes with aging, number one, for those who don't mind it, is Botox. But then she also mentioned that great skincare can help to, I think slow the progression, and especially when you have retinol product that help to rejuvenate. And then that also includes sunscreen. You might want to use sunscreen very well and generously because it helps to reduce the wrinkling that comes with the UV rays from the sun, I guess the ones induced by that. Now, moving on, saggy skin. Is there something that you can do to reduce or slow down the progression of your skin sagging?
So yes, it's it's the quality of the skin. So again, it comes down to good skincare. Now, will that totally slow it down to the point where you won't need any intervention if you want it? Not necessarily. But again, Black people age at a much slower rate. So whereas a typical white woman would come in for a facelift at around beginning at around 50, a Black woman might not need it till she's 60, 70. The quality of our skin is better because we have more melanin. So it helps. It helps to be Black. Black don't crack for real. But again, if you maintain good skincare regimens, um, you're always gonna the reason why we see sagging is because as we age, we lose elastin in our skin, we lose collagen. So if you're always building collagen by investing in good skincare, then you can really, really slow that down even more to the point where you may never consider a facelift at all.
Mm.
The other thing that I want to know, especially that's true in Nigeria, is that we have a lot of women who yo-yo in terms of their weight, right? Um, and when that happens, you really do a lot of damage to the skin, especially in the face. So if you're constantly gaining weight, significant amounts of weight, and then losing it, you're more apt to see kind of more rapid facial aging. So the good thing is to always kind of be on the healthier side, right? Drink water, work out, go to sleep, and sleep well, eat well. And these things will eventually, they are not just good for the body in terms of how it feels, but also how it looks.
And the female elephant in the room, sagging breast. Is there anything you can do about it?
No. Oh, yes, there's surgery, but in terms of prevention, not really. I mean, especially if you have kids, it comes with the territory. So the main solution is surgery. If you really are bothered by sagging breast, that is the main solution.
Not even some specific kinds of exercises?
I mean, when I was growing up, I heard that pec exercises were the thing that would prevent sagging breasts. I was in the gym just doing chest presses all the time, so I wouldn't ever get sagging breasts. But the truth of the matter is, as we age, gravity wins. So
Oh, wow.
they will sag, and it's just a matter of how much they do. The bigger the breasts, the harder they fall. So they sag even more than smaller breasts do. But surgery is the ultimate fix.
Well, I guess this is the part where we say know all these and no peace. Just come to terms with it. I'm
Yeah.
curious though, if a person needs to get a breast lift, do you do some cuttings? Do you have to put some implant, or how do you transform a sagging one to a pecky one?
So it depends on kind of what the issue is. So let me give you an example. So if a person has come to me after they lost a lot of weight, they've also lost a lot of their breast volume as well. And so usually when that happens, not only are they saggy, but they're kind of flat, and that cleavage that we normally appreciate, they don't have. So things that I offer them are not only a lift, which actually means to lift the whole thing. Even the lift won't address loss of volume in that cleavage part. And so two things that we can do. We can either put a small implant in there. It won't change the size significantly, but it will restore cleavage. Or we can use someone's own fat. So we suck the fat from their belly or wherever they want to get it sucked from, and then put it in that area, and that restores cleavage that way.
Each time I hear about sucking fat from one part to the other, I cannot tell you how I dread it. And I think about all the things that can go wrong.
I mean, there are always things that can go wrong, but it's actually it's really well tolerated. People do really well with it.
Hmm.
Yeah.
And on a final note, the tummy, Does a woman have the possibility or the potential to develop a bigger tummy when she ages, or it's the other way?
It has to do with the lifestyle. So the tummy is purely lifestyle. It has nothing to do with aging. Um, when we age, we can more easily gain fat in some ways, but for some women, they lose fat as they age. So there really is no kind of one size fits all for everybody. But the main thing is that if you stay healthy and you eat well and you don't fluctuate weight in such really strong ways, that you can maintain your physique for years.
Mm. We have now come to the end of the show for today. What will be your final words, recommendation, advice, or anything for the woman listening?
I think, it's easier said than done, but try not to judge yourself too harshly. If you want to seek out a plastic surgeon, there's no shame in that either. Accept yourself. If a change is what you want, then a change is what you deserve, right? But always be able to examine the why of what you're doing before you do it.
Thank you. And for people to find you across socials, what are your handles?
So I'm Dr. Kpaypee, all one word, DrKaypee on Instagram and YouTube and even TikTok, even though my TikTok isn't really anything. But but yeah, definitely Instagram and YouTube. Please find me there.
Thank you so much for your time and presence this morning. I mean, I do appreciate it. We've taken 1 hour of your sleep.
It's okay. I
Thank
went to bed
you.
early.
Thank you so much. And
Thank you.
cheers to more education and more people understanding the nitty-gritty of this before taking a decision so that they don't
Right,
come back and say, you preyed on me. Nope.
right.
Thank
Exactly.
you.
Thank you very
And you can
much.
find this video on YouTube at Smooth 920 FM Lagos, at Smooth 920 FM Lagos. The title of the video is hashtag Soul Sisters 981, Beauty and Aging, Cosmetic Do's and Don'ts. And I hope that you are better enlightened as a result of listening to the conversation. And you can also help yourself and help another person through the information you have gathered this morning. Do take care of yourself and have a lovely morning. Well, it's almost afternoon now, and I hope that you join me on the other side while we're playing you great African music on the Casbah from 12 p.m. till 4 p.m. My name is Oluwaseun, and this is Smooth 98.1. Yay!
Thank you.
Thank you so much.
My pleasure.
So
My
I'll just
pleasure.
drop this link in case you want to go back or share it in any form. So I'll just share it
Okay.
with you.
Okay. Sounds great. Have a
Thank
great
you.
morning.
And you